Be honest. When was the last time you spent a full day at a screen and felt by evening that your eyes were just burning? Or this. You step outside on a windy day and your eyes immediately start watering. Which is confusing, because if your eyes are dry, why the tears? Or this one. You're looking at text, it goes slightly blurry. You blink, briefly clearer, then blurry again. On repeat. Most people write this off as tiredness, bad sleep, too much screen time. And they're partly right. Those are all factors. But behind these symptoms is a specific condition with a name, clear causes, and real solutions. Dry eye syndrome. Estimates suggest 1 in 5 adults has it. It's one of the most common reasons people visit an ophthalmologist. And at the same time, one of the most underestimated conditions, because most people simply don't realize that what they feel every day isn't normal. Today we'll cover everything. What happens inside the eye, why it happens, who's at risk, what works, what doesn't, and when it's time to see a doctor. The surface of your eye isn't just the white and the cornea. It's constantly covered by a thin tear film that you can't see and usually don't feel. But this film is what protects the eye, nourishes it, keeps vision clear, and maintains comfort throughout the day. The tear film has 3 layers. The outermost is oily, produced by the meibomian glands, which sit along the edge of the eyelid. This layer holds moisture in and slows evaporation. The middle layer is watery. It makes up the main volume of tear fluid and supplies the cornea with oxygen and nutrients. The innermost layer is mucus. It helps the film spread evenly across the eye surface with every blink. All 3 layers work as one system. If even one is disrupted, the film becomes unstable. It breaks apart before the next blink. Parts of the cornea surface are left exposed, and that's when symptoms appear. Burning, a gritty feeling, redness, discomfort. This is why dry eye isn't simply not enough tears. Tears can be produced in normal amounts, but if the oily layer is compromised, they evaporate too quickly. If the mucus layer is disrupted, they spread unevenly. That's why someone with dry eye syndrome can be crying and still have dry eyes. The lacrimal gland responds to irritation with a flood of tears, but that's a reflex response. It doesn't restore the film stability. Dry eye syndrome doesn't look like illness in the usual sense. It looks like everyday discomfort that people live with for years, assuming it's normal. In the morning, manageable. By midday, heaviness sets in. After a few hours at a computer, burning, the urge to rub or close the eyes. By evening, eyes are red, tired, and you just want to lie down. Outside in wind or cold, tears flow on their own. Not from emotion, it's a reflex. Cold or dry air irritates the unprotected corneal surface, and the eye tries to protect itself with a flood of tears. But as I said, those tears don't fix the underlying problem. In air-conditioned spaces, worst of all, dry indoor air accelerates evaporation of an already unstable film. On planes, many people notice their eyes can barely stay open by the end of a flight, exactly because of this. Contact lens wearers feel it more acutely. Lenses sit directly on the cornea and require constant moisture. With dry eye syndrome, lenses start to feel uncomfortable. They burn, stick, eyes redden faster. People assume their lenses are wrong or poor quality, but the real issue is the tear film. And one symptom almost nobody connects to their eyes: fluctuating vision during the day. You look at text, it softly blurs. You blink, briefly sharp again. A minute later, blurry again. This isn't fatigue or another condition developing. It's an unstable tear film breaking and partially restoring with each blink. Dry eye syndrome is almost never caused by one thing. It's usually a combination of factors overlapping. The most relevant factor today, digital screens. Normally, a person blinks 15 to 20 times per minute. In front of a screen, 2 or sometimes 3 times less. And it's not just frequency, quality matters too. When focused, people often blink incompletely. An incomplete blink doesn't properly refresh the tear film. Hours of this every day, and the eyes begin to react. Air conditioning and heating. Offices, cars, apartments, planes. Dry indoor air literally pulls moisture from the tear film. The longer you're in that environment, the faster the film destabilizes. Age. After 40, tear production gradually declines, a physiological process. In women after menopause, this is especially pronounced, as hormonal changes directly affect the function of the lacrimal and meibomian glands. Contact lenses worn long term. A lens occupies space on the cornea and disrupts normal tear film distribution. Over time, this can worsen dryness and discomfort. Medications. One of the least considered causes. Antihistamines, antidepressants, certain blood pressure medications, oral contraceptives, all can reduce tear production as a side effect. If you take something regularly and have noticed your eyes getting drier, it's worth mentioning at your next appointment. Systemic conditions. Sjogren's syndrome, rheumatoid arthritis, thyroid disorders, diabetes. Dry eye is a common accompanying symptom in all of these. In such cases, treating the eyes goes alongside treating the primary condition. Blepharitis, inflammation of the eyelid margin, disrupts meibomian gland function and compromises the oily layer of the tear film, a very common, very underappreciated cause of chronic eye discomfort. Most common misconception: I'll just buy lubricating drops and it'll be fine. Artificial tears are a reasonable symptomatic tool. They provide temporary relief and soften symptoms, but they don't fix the cause. If the meibomian glands are blocked and not producing the oily layer, drops will evaporate just as fast as your own tears. The glands themselves need to be addressed. Second, I just need to use screens less. True, but incomplete. Reducing screen time lowers the load, but if the tear film is already unstable for other reasons, that alone isn't enough. Third, it'll go away on its own. Dry eye rarely resolves without addressing the underlying cause. Chronic drying of the cornea gradually leads to microdamage, reduced corneal sensitivity, and inflammation. Not a crisis, but something that worsens slowly and invisibly. Fourth, important for anyone considering vision correction. I have dry eyes, so laser surgery isn't an option for me. Not necessarily. Dry eye syndrome is assessed separately before any surgical planning. In many cases, it can be corrected beforehand, making surgery possible. Each case is evaluated individually. The 20-20-20 rule. Every 20 minutes at a screen, look at something 20 steps away for 20 seconds. This isn't just rest. It's a chance to blink properly and refresh the tear film. Conscious, full blinking. Strange as it sounds, it works. Remind yourself to blink slowly and completely, especially during focused screen work. A humidifier near your workspace. Simple, effective. Meaningfully slows tear film evaporation throughout the workday. Screen position. Monitor at eye level or slightly below means less exposed eye surface and slower evaporation. Monitor above eye level means wider open eyes and faster drying. Warm compresses on the eyelids, helpful when meibomian glands are involved. Gently warms and softens their secretion. A simple home procedure that supports gland function. All of these are supportive measures. If symptoms are constant and affecting your daily life, proper diagnosis is needed. Because treatment depends on which layer of the film is disrupted and why. Different causes, different approaches. and getting this right isn't possible without an examination. If burning, grittiness or redness occurs several times a week, that's a reason to come in, not a reason to keep tolerating it. If you wear lenses and have been handling them significantly worse than before, also a reason. If vision fluctuates during the day and briefly improves after blinking, worth discussing with a doctor. If you take regular medication and have noticed your eyes getting drier, mention it at the appointment. Diagnosing dry eye is straightforward and painless. The Schirmer test measures tear volume, fluorescein testing shows how quickly the film breaks down, gland examination reveals their condition. This doesn't take long and gives a clear picture of exactly what's happening. Dry eye syndrome isn't something to live with and accept. It affects your productivity, concentration, and quality of life every day. And with the right approach, it responds well to treatment. You don't need to wait until it gets much worse. You don't need to keep trying different drops at random, hoping one will work. You need one proper examination to understand what's actually happening and then move in the right direction. If you recognized yourself in what I described today, come in for an examination at Ko'z Nuri Clinic. We perform complete tear film diagnostics, assessing tear volume and stability, meibomian gland function, and any corneal changes. After the exam, you'll know exactly what's happening with your eyes and what can be done about it. No guessing, no trial and error. Contact details and booking are in the description below.